part of the earth element. It sometimes does not want to shift, and due to the history of the organism or the person, the muscles can be very tight and used to being off in a certain way, and it'll pull out. So anyway, I'm kind of back to what we're talking about.
Right, but that's a point that's good to make. So now, another couple stories that touched you.
Oh gosh, well, what's touching is when you can see how quickly it works. You know, having someone that has a tremendous amount of pain in the low back, and when we do the leg test where we see the imbalance of the legs, and we have them turn side to side, and we can kind of test the static and the stress and how the hips are lying. You know, seeing people who have a hip that's raised to one side, that's obviously the traumatic side, the short leg, and seeing it be in balance immediately, you know, after the installation, doing the leg test after, and seeing that the balance has restored, and seeing that there's evenness. The shoulders have immediately dropped and have pulled back. In other words, the guarding and the protection has let go. So, you know, I see that a lot, and I'm very touched by that, and that's a pretty common thing. But actually, now that you mention it, I'm recalling, you know, sometimes I forget, you know, because I see so many people, but just yesterday or 2 days ago, we had a woman who had severe scoliosis, very advanced. She's in her 70s or 69, I believe. Very difficult atlas to palpate. Her spine was, of course, completely crooked, and the muscles were, you know, of course, you know, had developed, you know, to accommodate that, and working with her, and her partner was wonderful in creating the space for her, because it was intense and painful, and having her respond in the way she did after it was installed, the eyes brightening up after 69 years, feeling for the first time her head being able to turn with greater mobility without the restriction, you know, and almost feeling the emotions coming out, where her breathing changed, you know, and just thanking God and Creator that she had come, and that this modality was here.
Amazing.
And that we could do it in one treatment and not pull people through a series of
Which is
treatments.
expensive, it's time-consuming as well, just on a practical level. What a relief
Absolutely.
to know that you can come and have something so profound done in such a short space of time. So what are some of the reactions that people might experience with such a profound type of shift going on?
Yeah, good question. And you know, it's really hard to say, because we have to take into account of the vitality of the being, what kind of history they have, what kind of accidents and trauma they've gone through, and what are they coming here to receive from it. You know, again, some people just want to feel better physically. They have lower back pains, and some people want to feel more spiritual clarity, or they want to have deeper meditation or whatever. Or, you know, I just had a call from a man in Colorado who does Kundalini work, and he finds that everybody gets stuck right at the nape of the neck. So people are coming for that to be opened up and to have a reaction which allows more energy flow. Typically what you get immediately is like, oh my goodness, I can turn my head again without having to move the whole torso to look behind you. So physically what people will feel is openness in the neck muscles, and then the mobility of the head. The shoulders will feel better. Breathing changes. The low back can open up, and immediately you see, like I mentioned before, the hip will drop,
right.
And then the legs will actually become closer to almost perfectly even. But again, that has to do a lot with the individual. Some people have had surgery, some people have had discs removed.
They're fused.
And they're fused, and so, you know, whether that will ever regain 100% normality, or whatever normal is, really,
right.
You know, it's hard to say. And sometimes, you know, the physical benefits and reactions could be a lifelong thing. And again, due to your vigor and vitality, you know, that has a lot to do with how quickly we
right.
regenerate. But typically, physically, you know, you're going to have a feeling of spaciousness. the pressure is released off the base of the skull, and you just have a feeling of freedom. Now, going into the emotional thing, what people have told me about is that it's helped them get through emotional trying times in their lives.
Mm-hmm.
It brings up anger, it brings up sadness. I've had feedback from clients that became very angry. They expressed anger for days, and then I had people tell me they wept like babies. But all of it being very cathartic and all of it being very healing for them. And this work seems to bring out what this person needs, or gives them what they need for whatever thing they're going through.
Mm-hmm.
And then I recently had a call from a man that didn't come to me with any physical problems, has felt good, middle-aged gentleman, and he came for a more spiritual awakening, and his atlas was not far off, but it was out. But he had tremendous shifts, as a body worker himself. He was feeling his hands getting hotter during his sessions, greater sense of energy flow in his body, a feeling that, feeling optimistic in his life. Self-actualization is a big thing, feeling a little more, confident in just,
it makes sense. I mean,
life,
once you start releasing that amount of energy and allowing for it to flow freely, I guess it could touch any aspect of life. And by the way, that sound in the background, which I'll just mention because I'm sure that our viewers will be hearing it, are the cicadas here. It's just a beautiful, Page Springs area. It's
like
beautiful.
A chorus.
A lot of wild critters, and it's a chorus of little bugs out there right now.
Yeah.
Also, one can get really tired, I understand, sometimes in the beginning of the healing process. You have to kind of allow for that. And can you talk a little bit about how that might show itself and how long it might take?
Well, one client said she slept for 4 days.
Oh, okay.
But to me, and then, further, investigating her life and what was happening at that time, she was going through a career move, she was selling a home. She was exhausted from the pressures of her work environment.
She needed to rest.
She needed to rest. And then I had a woman call me that she couldn't sleep at night. She had so much energy from the treatment that, she got a whole lot done around her house, but she was exhausted because she couldn't sleep, because of the energy.
Right.
But typically people feel tired, and that's kind of a generic way to tell somebody, take it easy. There's been a shift here, whether you're aware of it or not, and as subtle or as sensitive as this work can be for some people, just take it easy and just be allowing to what is going to come up from this. And if you need to sleep for a couple days, allow that to happen. But again, when I was installed, I, very active and doing my body work and raising kids and everything, there's no time to sleep. So, but I was fine with that, and that was just who I, my history. But some people, do feel tired. They feel lightheaded. They can feel dizzy. As we're working with the neurology of the organism, there's a lot of things that can come up from that. Mm-hmm. So, yeah, that's a common thing, which is great. I think we all need to rest
a little bit
yeah,
more. Well, it would seem logically that this should be taught almost ordinarily in chiropractic school, for example. Are more chiropractors coming into this awareness, and can we see a time in the future where most chiropractors will understand this and have that included in their practice as well?
That's the hope. I would hope so. And I think there's a lot of very open chiropractors that have moved away from the typical experience that most people get, and,
Yeah, so let's hope. It's not there yet, because it sounds like it's still fairly new in the U.S.
It is. But it's almost like it's a taboo thing. Like, oh, let's not mess with the atlas because, God, you could get paralyzed, and one little slip of the atlas and you could have permanent damage. And I almost feel like it's a liability, fear-based resistance to the atlas work, where it's only, designated for neurosurgeons who go in and, go in from the front and adjust the atlas and relieve the pressure there. I think it's a much more grassroots, simple procedure, and the overwhelmingly positive response from this work is that I feel like it can be incorporated into regular chiropractic work, and it needs to be the cornerstone of spinal health, in my opinion, because, in other words, I have a friend who just went, 10 sessions of Rolfing to deal with her neck problems and her back problems, and after this 10 sessions, she feels her body's out again, and for her I would have said, hey, you need to get your atlas in first so that the muscles can be open enough to receive further chiropractic treatment. I think chiropractic treatment is vital, and I think it's very important, but to neglect the atlas like I feel that a lot of chiropractors do, and at least with my own experiences, the few people that I've seen, they don't talk about the atlas. They don't palpate it. They don't even think about it. And they start from the bottom up, going from the depending on the chiropractor, of course, but lower lumbar to the thoracic, then up to the cervical. And if the atlas is out, try to imagine, when you're winding up an extension cord that's plugged in or something, and it's in the socket, and it gets taut, or a hose that is full of water still, you haven't released the pressure, and you're trying to wind it up or manipulate it, and it starts to create tension along the path. And then what happens is once you leave the office, it unravels back to the position and the luxation of the atlas. So again, I feel like that needs to be square.
So really the foundational part is not.
Well, doesn't it make sense?
Yeah,
it's the uppermost bone,
absolutely.
and it guards and assures an opening of the foramen magnum,
Absolutely.
where all the ascending and descending nerve tracts are running through. It's like, this is important. And so I feel like...
And beyond that, you're talking acupuncture meridians and such as well. All of the energy and chi flows go through there.
Our whole relationship to the world is running through that column. It's vital, and I do feel like it's going to shift. And and I have we had these two lovely chiropractors come the other day, and one of them was the scoliotic patient that we were discussing a bit ago, and her partner was just completely open to it, and he was wonderful. And so
I know who you're talking about.
Yeah.
Is he going to take the training?
I hope so. He was
Good.
interested in doing it, and I do feel like the chiropractors are going to go for it, because I feel like subconsciously they know that they don't want to keep seeing these people again. They really do want to heal them and see them on their way and kind of get them out of their office and maybe come back in a month or so. But I've had clients come to me getting neck cracked once a week, and I'm just going, there's something wrong here. To have that kind of tension and torquing on the spine, once a week or once every, and then having, a lot of the Atlas folks, need to take X-rays all the time. But X-rays don't give you an idea of their emotional state or how the muscles are, the tension in the muscle structure. It doesn't give you an idea of their personal history or what's going on energetically or emotionally. So, again, I think we are seeing one side of the picture, and, I feel like this is going to open up. And a lot of people are calling me about the reversing the curse, and a lot of people just tend to be gravitating towards this work because of just wanting mostly on a spiritual path that they're on.
Right, wanting to be truly open again to all the forces.
To feel their abundance, to feel everything that's coming in and going out,
Yes.
So.
Well, any final thoughts on it? Anything we have not covered? Because that's a lot of good information. That's
yeah, I feel like I spoke a lot.
I think so. I think we've got it. So I just want to thank you so much for your time.
My pleasure.
Yeah, I hope many people watch this and start seeking help in this way, and more chiropractors and healing practitioners taking this on as well. It really takes both, doesn't it?
It does, and I would say just one last thing, it's very important to tune into our intuition and to know what is right for our bodies and not get too overloaded by, fancy medical terms and pathologies and things that, our traditional healthcare system wants to throw on us. And I feel like we have tremendous amount of vitality still to self-heal and to self-regenerate, and I think that's what's going to empower us for the things to come and the shifts that I think are happening in our lives.